Welcome to the Beverly Hills Plastic Surgery Podcast. I'm here with my favorite co-host of all time, Dr. J. Calvert.
Oh, thanks.
All time.
Wow, I beat the other ones. Wait, there aren't any.
No. No, but
That's
really.
good though. I'm happy.
How are you?
I'm good. I'm very happy to be here. We're, once again, very close to the body shop, and I thought we might want to change these podcast episodes to a different podcast name. Could be like podcasts and lap dances or something like that.
We could do that.
It's right there.
It's right there.
And that is a famous spot in LA.
Yes.
Enter if you dare. That's all I'm saying.
Yes. We're still podcast studio hopping, and yes, we are.
I'm just saying, like, there's got to be like some sort of disinfectant or hazmat suit. I don't know what you need to go in there, but we're not going.
We're not going to check it out. Not today.
We're just going to do our podcast and go back to work.
Yes.
Thank you.
But today we are actually talking about something that has been bantered around in the sort of plastic surgery world. Like, I've talked to you about it. I've talked with other plastic surgery colleagues at different meetings, and just the idea of, do you need a plastic surgery specialist? And this came up for me because I had a patient who I had done her breasts. I can't remember what exactly we did. And then I think later we did some kind of face surgery, blepharoplasty, and then she needed a facelift. And we were kind of like, it's over a course of, 4, 5, 6 years, something like that. And when we were teeing her up for her facelift, she was like, my friends are saying I need to go to this doctor for this surgery, and I need to go to this doctor for that surgery. And she's like, but I know you and I like you. You've done a great job for me on everything else so far, so I want you to do my facelift. And I was like, well, yeah, and I'll do a great job for you on your facelift. But her friends were in her ear telling her, oh, no. You don't go to the same plastic surgeon for all of your surgeries. You find the specialist in that particular surgery. And it is a topic of debate, even amongst plastic surgeons themselves. Like, do you specialize or do you stay fairly general with what you do?
I think it's an important topic because other specialties weaponize our plastic surgery training against us to say they're general plastic surgeons.
I know, they make it sound so dirty.
It's like...
so we did like 10 years of training?
Right.
Oh, yeah, that's awful.
Don't go there. I did 1 year of aesthetic surgery. They only did 7. They're general plastic surgery. Like, it's the stupidest argument. And the people who use that, and you know who you are, it's like, come on now. We do plastic surgery out of the gates, from right out of medical school in our training, which is now a minimum of 6 years.
Yeah.
Even during the time that you in your internship, I did so much plastic surgery over 7 years. I ran an aesthetic surgery clinic when I was a third-year resident. I did aesthetic surgery from the time I was a third-year resident to the time I was a seventh-year resident, doing 30, 40, 50 of my own cases, let alone the train. Like, who did a 1-year fellowship is going to point at me and say, he's a general plastic surgeon. Don't go there. Are you crazy? Come to me. I did a 1-year fellowship after doing everything under the sun, from prescribing steroids for, it's like, no, you need to realize what it is. And so I believe that you need to find a great plastic surgeon, whatever their training, because there are people that are good at these operations, and then there are people that can do these operations. Plastic surgery is very interesting because in general, if you go to a plastic surgeon who practices aesthetic surgery, you're going to get a good operation.
Of course.
Whether you're a facial plastic surgeon that, trained in ear, nose, and throat, which again, everyone kind of says, oh, well, they're facial plastic surgeons. They're specialists. That means they did a 1-year fellowship and got boarded by a non-ABMS board, which is basically a private corporation. They got boarded by a private corporation, not in the American Board of Medical Specialties, after doing a 1-year fellowship. Great. It doesn't mean that they're good or bad at it. You have to look at their before and afters and use all the same kind of criteria. Can they do this operation? And maybe they do a lot of noses. Maybe they do a lot of facelifts. Maybe they do a lot of lip lifts. Maybe they just do a lot of Botox. Who knows what they do? Because it doesn't matter that they did the 1-year fellowship and the 5-year ENT residency. They're either good at it or they're not. You can look at general surgeons who go into plastic surgery the same way. They did 5 years of general surgery. They did 2 or 3 years of plastic surgery. Does it mean they're good at it? Who knows? Look at the before and afters, vet the operation. But for people to weaponize the fact that we did the training that we did against us, saying you need a specialist, is something that you know that I don't like. It's using false information to gaslight the crap out of the public. And it's uncool. It is not right for the consumers of these operations. You know, the patients that want these operations are misled, they're misdirected, and it's a lot of hand-waving and bullshit that drives me crazy because it's not fair to the patients. And it's so hard to get to the right plastic surgeon if you're being misled down some primrose path that's not based on anything other than, come to me, I'm better. And they can fall for it, and people do all the time.
Well, this was going to be the podcast.
Did I go on a rant?
I think
Sean,
I think we can end.
Was
right
that a little
there.
bit of a rant? A little bit.
I mean,
Okay.
he sums it up pretty nicely.
I just wanted to be clear about it because that's really what it's about. So this came to me because I have a patient who wants a facelift, and she was in my office, and she literally said to me, in a very disappointed way, I just wish that you only did facelifts.
Oh.
And it's like,
that hurts my heart.
but it's like, well, I'm not going to only do facelifts because I'm really good at plastic surgery.
Yeah.
And the things that I'm good at, I do very frequently, very often. And it doesn't mean I don't have problems with those things. Every surgeon who operates has problems with all the operations, whether they do them all the time or a little bit of the time. But the bottom line is somebody saying, like, I wish you only did facelifts, shows you how sort of misdirected that, because my facelifts get better because I do abdominoplasties, because I do rhinoplasty, because I do lip lifts. Everything that I do is synergistic and it feeds off each other. It's all about beauty versus blood supply and understanding the anatomy. What you're really paying for when you hire a plastic surgeon is somebody who has a great eye for beauty, has GPS of the human anatomy, and understands how to make surgical operations look beautiful. That's what you're paying for.
And you either have that or you don't.
Exactly.
Yeah. You can be someone who specializes in one particular surgery, but if you don't have an eye for what looks good, it doesn't really matter. At the end of the day, you want someone who's a good surgeon, who has a good eye for beauty, who operates a lot, who does a lot of surgeries, and you're probably going to do great because that same surgeon who is a good surgeon who has that eye for beauty is probably a conscientious surgeon, and they're not going to go out there and do some like half job. If they're going to put their name on something, regardless of what surgery it is, they're going to make sure that they're doing the absolute best, most up-to-date, skilled surgery that they can, because that's who they are.
100%. I couldn't agree with you more. And that's what you're looking for. So the fact that I do, complex breast surgery should be an indicator that I'm pretty good at doing plastic surgery in general. I mean, I have a friend who does breast augmentation. He does, I can't even tell you how many he does, and I don't think one of them looks good to me. And he does tons of them every year.
He does, yeah.
And it's all he does. And you know what? The befores and afters, they're not my favorite, but obviously his patients love him. And that's all that matters. If they love it and they love their before and afters and they love the results, it's great. I wouldn't do that. I don't want, a fist-sized gap between implants. But everyone that he does is submuscular, and he doesn't release the muscle, and he says there's no bruising because he doesn't barely do anything except lift up the muscle and shove an implant under it. So that's fine. If that's what you like, great. I like cleavage. I like to have a more voluptuous breast. I like that look, so I'm going to do more things to get that result, especially in my redo operations, because that's what people come to me for. But the fact that, I do revision rhinoplasty, primary rhinoplasty, facelifts, revision facelifts, it's all the same thing in the end, because you either know the anatomy really well, you either understand what good looking is and you understand how to do the operations, or you just don't have it, and you'll get results, which are fine.
They'll be fine. They'll be fine.
They're fine.
So I guess the question is, as someone who, and now I'm going to throw this back on you, is a rhinoplasty specialist, especially a revision rhinoplasty specialist, are there times when you should go to a specialist? Air quotes, specialist.
Yeah, but I think I'm more talking about that single specialty surgeon. Like, all I do are noses. Like, I think there's something, if you're that guy that all you can do, or that gal that can just do noses all day long, good on you. I can't do that. I think that I would get I would lose my edge. I think I would lose that, like I walk into the operating room and to me, it's an opportunity to be awesome. It's an opportunity to do the best operation I've ever done, to shine for my patient, to give them what they came for, to be safe, to be smart, to learn from what I'm doing, to discover things, to make it better while I'm doing it. So I can take advantage of everything that I've done and learned up, to this point in my career. If all I did was the same thing every single day, over and over and over and over again, I might be able to do that. Like I might. It's just not the way that my brain works. So there is somebody whose brain works that way. I mean, the guy that was my mentor, Roland Daniel, he didn't do anything but rhinoplasty. Occasionally he'd do a brow lift. Occasionally. But he noses all day, all night. That's all he did. And were his results great? Of course they were. Were his patients happy? Yeah, probably to the same level that mine are. Did he have complications? Of course he did. So it's just a matter of how you learn and what makes things amazing to you. But for me, I find that the synergy of plastic surgery, of all the different operations, makes me better at each individual operation. And I do them all so frequently, I'm not sure I need to do just one thing to be good at it. Maybe there is somebody that's what they do.
So I think that's the difference though between like what you and I prefer as surgeons and what makes us happy and what makes us feel fulfilled. But then on the patient side, like I'll go back to this. Should they be going to a revision rhinoplasty specialist, or can they go to their general plastic surgeon to get a revision rhinoplasty? The same surgeon that did their mommy makeover, maybe did their upper bleph.
I mean, there are some things that you want. I mean, you want to know that. So if the surgeon that did their mommy makeover does 50 revision rhinoplasties a year, then that's fine.
Yeah.
Then that's a great surgeon to go to, or even 25 revision rhinoplasties
Still
a year. They know what they're doing.
Yeah. So basically, you just need to go to someone who does these frequently, any surgery frequently, but you don't need to go to somebody who does one surgery exclusively.
Right.
But as long as that one surgeon that you're going to does whatever surgery it is that you want them to do on a routine basis with good results, that's great.
Right. And this is why I say we know more about Mookie Betts' chance of hitting a home run with a man on second base in the third inning than we know about our doctors. We don't know anything about that, which is why my stats are kind of open to the public. Like, I want people to know, how many facelifts do you do? Well, I'm doing, 3, 4, 5, 6, 7, 8 a month, depending on the month. And how many rhinoplasties are you doing? Well, I'm usually doing 10 to 12 a month. How many of these, so the numbers, I think, speak for themselves.
The numbers do speak for themselves, but also, like, what is the right number? Because I have had patients come and ask me that because they were told by their, like, Glamour magazine, like, 10 questions to ask your plastic surgeon. And one of them is like, well, how many of these do you do in a month? Or how many have you done? And I'll rattle off whatever number. And their eyes just glaze over and they check the box and they say, okay. So,
well,
like,
that's true.
Because what is the right number? Is the surgeon that does 15 rhinoplasties a month this equivalent of someone that does 5? I don't know. I don't know that there's a set number that you need to be aiming for because everyone is different. And so all to say, it's hard to know everything about your plastic surgeon, even with complete transparency, which is why go to the befores and afters. It just comes back to that.
It always comes back to that. Look at the before and afters.
Do you like
Make
them?
sure. Yep. Do you like them?
Like
Are
the
there enough there
surgeon?
on their website?
Okay, then go for it.
Then you're good.
Yeah.
I mean, but this is where, I don't know. I played baseball. I was a long ball hitter. That was kind of my thing. And I watch a lot of baseball now, and I see, and there are times where you know that this is the right guy at the plate who's going to make things happen. Like, we were just talking about Kiki Hernandez, who is one of my favorite players of all time.
Me too, because I like saying his name.
Kike Hernandez. Yeah, he's amazing, right? So this guy, he's just a gamer, and like every time that I'm just like, oh, thank God he gets in the game, he smacks a home run with 2 men on, with 2 outs, and just.
By the way, we're in the middle of Dodger playoffs right now. If you're wondering where all the baseball metaphors are coming from,
it's going on right now. Like, hopefully the Dodgers are going to make it past San Diego and come back home tomorrow night. But the reality is that those stats are real, and they should be real for us too. This was. this has always been sort of a subject of discussion for me, is like, what are, like, and Terry DeBro and I talk about this a lot when guys say, oh, I do 350 operations a year. When you look at their stats, it's actually 140. Oh, I do 500 of those a year. No, you don't. You actually do 110. And when you get down to it, the average plastic surgeon probably does about 150 operations a year. That's reality. When I, like, there was some year that I did like 275 noses in a year, and it was too much. Like, and now I do way less than that, but I still do well over 100 to 150, and half of those are revisions and half of them are primaries. But I don't do 300 primaries a year. I don't do an hour and a half operation. I don't do a nose in an hour and a half. Look at my results. They don't look like they were done in an hour to an hour and a half. They're done in a very proper way, and they look great. That's why it takes that time.
So the hard number doesn't mean anything.
I don't think it means anything. Just because you did 300
in a year, or that surgeon did 150 in a year, it doesn't mean anything.
No, and there's a guy in Phoenix. He does like 300 noses a year because all he does is noses. He's ENT facial plastics, trained by a great facial plastic surgeon, and he cranks them out, and he gets great results on primaries. When he sees a secondary comes in, he says pass, because he's got a thing. He's got a system that works for him, and it's great. And he loves doing just primary rhinoplasties, and good for him. And that's all well and good, but I think that it's hard for the public. This is once again why they have a hard time getting to the right surgeon, because there's so much
noise,
just tremendous noise to wade through, and it. I don't know how you get there. I don't know how you find that surgeon.
I feel like we've had this discussion in multiple podcasts about how to choose your plastic surgeon over and over again. And even I still get confused at the end. I'm like, God bless the public. Like, I don't know how it's got to be so hard. So just, referrals befores and afters.
Get a referral befores and afters. If you believe you need somebody that only does your procedure,
then
have at it. That's fine. But I think that you probably miss some opportunities that way, because even some of the top plastic surgeons in the nation known for rhinoplasty, if you look at the 1, 2, 3, and 4 on the Newsweek poll of the top rhinoplasty surgeons, Rod Rourke does not just do rhinoplasty. He does facelifts. He does whatever. That guy is he's a surgical machine.
Yeah.
Number 2, me. I do facelifts, rhinoplasty, complex breast, and I liposuction 20% of patients that go into the operating room for any of those 3 operations, because people like to get lipo. So am I a liposuction expert? No, but I'm really good at it, and I do some amazing stuff with it. You don't need to go to somebody who just does lipo to get liposuction. Let's look at who's behind me. Bauman Guyron does brow lifts, facelifts, all that. Behind me, there's Ash Ghavami. Ash Ghavami does, he said today when we were talking to him, he said he could have a website called Nose and Butts, because that's what he does. He
really does. We need to get an acronym or something for him.
But then he also said, but I'm doing a lot more faces, because he's in his 50s, and he does flash recovery breast reduction.
Yeah.
So just looking at those, those are the experts in noses, but they all do other stuff, and they're really good at it.
Because they're good surgeons.
Ghavami is he's a super if I needed my butt done, he's doing it. He's great. he's the man, and he's great at noses. So I think that the public should read into it, learn a little bit more, get educated, and then you'll decide whether you need that single specialty surgeon, or you can go to somebody who's actually really good at it and you like their results, because that's who you should go to anyway.
Absolutely. Well, thank you so much for doing this podcast and giving us all of your insights.
Sorry. Did I tee that off a little too hard? I just, I'm passionate.
He's still going.
I'm passionate. No, I don't know what to say.
Well, that's why we love having you. That's why you make this excellent, because you are an excellent surgeon and you care about what you do and you care about your results, which is ultimately what it's about.
I just want the patients to get the best results they can. This is 100% about the patients having full information to get the best results that they can.
Absolutely. And with that being said, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.